we'll just go over the order, whatever the order is. Let's say if the order is for half a milliliter of the medication, we will just draw half a milliliter of air, okay, and then we'll basically we'll draw the medication, and then now for now so the difference for intradermal or TB test injection is that we will use only 15 degrees bevel up. The needle is supposed to be bevel up, and then we will go in only to the surface of the skin 1/8 of an inch. So basically we will stop once we see a little resistance. So we'll go in only 1/8 of the inch, 15-degree angle, and the needle is supposed to be bevel up. Okay, so and so basically that's it. So and then also as far as the information for the syringe, as I mentioned, the size of the syringe is 1 milliliter. Um, the gauge is supposed to be between 25 to 27, and also the needle size is between 1/4 to 1/2 of the inch. And then, so once we are done with our injection, we basically will activate the mechanism, the safety mechanism, okay? So that way we won't hurt ourselves. And then we will basically just dispose it into the sharp containers, and that's it. So we are done with that. But then there's also a follow-up procedure with TB injection that we have to check after 30 minutes. We will check to see if there is basically if the skin is a little bit increasing, or because of the medication under the skin. So that's basically that's about it. And the last type of injection that I will be talking about, it would be the it would be the insulin injection, subcutaneous, or also known as sub-Q, which is for administration of insulin, heparin, or vitamin K. So for this type of medication, our syringe doesn't go by milliliters anymore. We go by the units. So it's usually between 0 to 100 units. So so now there are a few things about there are a few things about the insulin shots that I would like to mention. So there are a few different sites. We could use underarm. We could use abdomen. We could use upper back, or we could also use the leg. But the most common sites is usually it's like abdomen site. Now, if so, normally we use 90-degree angle for insulin shots, but if the site it's thin, and there are not so much fat tissues, then we have to use 45-degree angle, bevel up. Okay, and also as far as some information about the syringe. So as I mentioned, the syringe is 100 units. The gauge is between 25 to 30, and also the needle size is between basically is between 3/8 to 1 inch. Okay, so also our order is to give basically 15 milliliter of NPH, which is intermediate acting insulin, and 15 units of NPH, which is our intermediate acting insulin, plus 10 units of fast acting or regular insulin. Now, for this order, we are able to mix the insulins. And why do we do that? Um, because diabetic patients, they basically they take so many injections as it is, so we don't want to give them more injections. So because this is basically just part